How general anesthesia works is not well understood. Sleep is very different. Your brain is like a large office building. At night, the lights may mostly be off, but the power is still on. There are still security guards, some people working through the night, maintenance crews, and so on. That's sleep. Sleep is not your brain turning off. Sleep is something your brain actively does. Importantly, while you are sleeping, your brain still has the capacity to wake back up whenever it wants to, e.g., in response to external stimuli, including pain. You'll also do things like shift position to stay comfortable, and so on. Unconsciousness and general anesthesia are more like the building has been evacuated and the power is out. In that state, the brain can't wake itself back up whenever it wants. And it doesn't do things like shift your body around. Pain signals can reach the brain, but it's like a burglar alarm going off when there's nobody there to hear it. The physical, emotional sensation of pain, i.e., hurting, is something your brain does in response to pain signals. If your brain is mostly shut down, then pain can't hurt, all of which is why unconsciousness is so dangerous, and why general anesthesia is only done under the close supervision of an anesthesiologist. Anesthetist here. There are a few elements to general anesthesia for surgery. At the minimum, you typically get something to render you unconscious, and something else to reduce pain. In my country, this is most commonly propofol, the anesthesia drug, and fentanyl, strong opioid. But there are quite a few alternatives and combinations we use for both purposes. As for feeling pain, it's actually slightly more complex. Pain is a conscious experience. The pain receptors on your skin or organs detect noxious stimulus greater than send signal to the brain greater than it generates a conscious unpleasant sensory and emotional experience that we call pain. Now, when someone is under anesthesia, a big part of this chain of physiological process actually still takes place. The pain receptor still works. It still sends signal, and it still arrives in the brain. In fact, we do see it in the form of increased heart rate and blood pressure, etc. Through intravenous painkillers, e.g., opioid, and local anesthetic, etc., we do reduce these signals somewhat at various points of the chain. Mostly so that when you wake up eventually you are not in huge pain. However, it is perfectly possible for the entire chain to stay intact. It's merely your being not conscious to experience the unpleasant emotional experience. Just an aside, but I recently heard a doctor, non-anesthesiologist, say the anesthesiologist's job is to keep the surgery from killing you. I just saw a video on this. Hopefully it was correct. Someone can explain better than me for sure. But basically, the anesthesia puts you in an unconscious state where the pain signals aren't being received and processed. So basically, your body and nerves still feel everything, but the signal to the brain is blocked so you don't experience it. There's a few interesting answers here, not all correct. The real answer is that you do actually feel pain. You're just not conscious. The inability to wake up is what separates sleep from unconsciousness. You can't wake up because of the drugs. We can actually typically tell when an unconscious person is receiving painful stimuli due to spikes in heart rate, blood pressure, etc. To counteract this, general anesthesia typically includes strong intravenous painkillers, or some other form of blocking pain, such as a nerve block. Anesthesia resident here. Pain signals are also known as nociception. These take place while under anesthesia, which can cause your blood pressure and heart rate to rise, and your body might move from the pain, depending on how deep you are under anesthesia. We constantly note these changes while you're under. There are other great analogies here describing why normal sleep is different. I'll just reiterate that pain itself is a conscious, emotionally driven process. When you're under general anesthesia, you are not consciously feeling the pain. Thus, it is described as nociception. When we see these changes, there are many things we can do. One is to do nothing. Young, healthy, can tolerate the changes to their vital signs. We can give pain medications. Fentanyl, hydromorphone, which will affect your body's response to the pain signals, usually decreasing the response. Deepening the anesthesia is also an option, which generally lowers your body's response to any stimulus. In certain situations, we might use specific medications to directly change a patient's heart rate and blood pressure in the direction we want. If someone induces general anesthesia, the patient will get between 2 or 3 drugs. Asterisk an opioid from the group of fentanyl analogs or ketamine. Asterisk a hypnotic such as propofol, thiopental, or etomidate. Asterisk depending on the type and location of the procedure. Also muscle relaxants such as succinylcholine or rocuronium. So in short, you get something. Asterisk for no pain. Asterisk for sleeping very good. Asterisk and for relaxing you muscles. You will not move and it's easier to put in tube down your throat. Just to add a little bit to the other very good posts I learned in a class about general and local anesthesia, that the surgeon will use a local even if you are under general anesthesia. This is because your body still responds to pain stimuli even if you are under. So the numbing is to keep your heart rate and respiration from increasing in response to the pain receptors triggering your autonomic nervous system. General anesthesia is not just sleeping meds. Along with the sleeping drug, example, propofol or inhaled agents, you are also given multiple powerful painkillers, opioids like fentanyl, etc. The amount of painkillers will vary depending on the type and the invasiveness of the surgery. If the painkillers are not given, there will be a big spike in your vitals indicating that the pain receptors are still feeling the pain, even though you may be unconscious and not responding to pain. This is the reason you don't feel pain under GA. I had surgery recently and there were actually 2 parts to the anesthetic. One was a nerve block that the anesthetist directly injected into the nerves. This effectively paralyzed my arm, so I both lost feeling in it and any ability to move it for about 12 or so hours. The other part was the general anesthetic that knocked me out for the 2 or so hours the surgery took. You're not asleep during anesthesia. You are in a coma from drugs. A special type of sleep which you can't wake up from until drugs turn off. Some of drugs are very strong painkillers and sometimes special injections stop your nerves from carrying pain. When your operation if finished, the very clever doctors turn all those drugs off and you wake up. For starters, you can't compare sleep and unconsciousness. Just because you're not awake in both states, it doesn't mean that they are the same. Sleep is a highly active state of unconsciousness, in which the brain is going through different levels of sleep patterns. At some points, the brain is even more active when we are sleeping, compared to us being awake. Drug-induced anesthesia is a very complex mechanism and is executed differently, depending on surgery and patient. Shutting off the pain is not very hard. We have a variety of painkillers that do that pretty well. Unfortunately, they have a little side effect. The stronger the painkiller, the faster it stops you from breathing. That is one reason why you are brought to unconsciousness. You would think that giving you just the drug for unconsciousness is enough for the surgeons to operate on you. But that is not true. You are not there to experience or remember anything. Sometimes patients do wake up during surgery, but don't feel or remember anything. But your body still reacts to pain. Your blood pressure rises, heart rate increases, etc. These effects are counterproductive for surgery. That's why you are given pain medication, even though you are unconscious. Technically, we don't really know how anesthesia works. Generally, it works by inhibiting activity in the central nervous system. Because the drugs target specific receptors in the brain that reduces neural activity and receptiveness to pain. That's the quick and dirty version. The thing is that we don't know exactly why. There is a general idea and hypothesis about it, but we don't truly know all the mechanics at work and why it works that way. We know what the drugs do and the effects on the body, but we don't know the exact mechanisms that causes the anesthetic drugs to have that effect. Am anesthesiologist, a true Eli 5. Your body still feels pain, your mind just doesn't know it. I.e., heart rate and blood pressure elevate when the surgeon starts if I haven't given a pain med. You just aren't conscious to know it. Regular sleep is physiologically very distinct from what we do and doesn't have the disruption to perception. If I cut you while napping, you will feel it and wake up screaming in pain. We only use put you to sleep as a way to more effectively communicate and not scare the general population as to what they should roughly expect. Since anesthesia is so dangerous, they use less of it these days. Enough to disable motor activity so they can work on you, but not enough to really shut down your nervous system. Then they add another, safer drug that stops you from remembering anything that happens until they wake you up. Anesthesia means you're asleep. Analgesia means without pain. Both of these are done so you don't remember the surgery, nor feel it. You do feel pain. You just aren't consciously aware of it. Your autonomic system can still respond though. Increased hour, BP, respiration, etc. I woke up during surgery. The surgeon was stitching me up. I could feel it clearly. And I spoke to him and asked if that's what he was doing. He said yes, but there was no pain at all. I was puzzled how I could feel it, but not feel pain, so I asked him about it afterwards. He explained that there are different pathways. I guess the explanation was dumbed down for a layperson. Then he said he was surprised I remembered. They give you a stuff called something like medullum. That stops you remembering. You could be in agony on the table and not remember it afterwards. Scared me a bit. You can't wake up when you're unconscious. Your brain is shut off. Your brain won't respond to all those pain signals. What if anesthesia just made you forget the excruciating pain afterwards? I know it's not the case, just wanted to share a rather terrifying thought. I've never had a surgery. And my biggest fear is that if I have one, I will feel absolutely everything without being able to move, react. But once you wake up from it, it's erased from your memory, so you can't remember the nightmare you just went through. I'm sure this is not the case, but the thought has crossed my mind more times than I'd like to admit. We also use blocks to numb the area being worked on. During jaw surgery, your whole mouth and face is numbed with lidocaine, Marcaine. Maybe not all surgeons do this, but they should, for at the very least the benefit of the patient and their pain. The latest theory of consciousness addresses this exactly. Orchestrated objective reduction, OR, is a highly controversial theory postulating that consciousness, https en.wikipedia.org/wiki/consciousness, originates at the quantum level. https en.wikipedia.org/wiki/quantum_mind. Inside neurons. https en.wikipedia.org/wiki/neurons. Rather than being a product of neural connections. https en.wikipedia.org/wiki/neural_pathway. The mechanism is held to be a quantum. https en.wikipedia.org/wiki/quantum_physics. Process called objective reduction. https en.wikipedia.org/wiki/objective_reduction. That is orchestrated by cellular structures called microtubules. https en.wikipedia.org/wiki/microtubule. It is proposed that the theory may answer the hard problem of consciousness. https en.wikipedia.org/wiki/hard_problem_of_consciousness and provide a mechanism for free will. https en.wikipedia.org/wiki/free_will \1 https en.wikipedia.org/wiki/orchestrated_objective_reduction #site_note-frontiers-1. The hypothesis was first put forward in the early 1990s by Nobel. https en.wikipedia.org/wiki/Nobel_prize laureate for physics. https en.wikipedia.org/wiki/physics Roger Penrose. https en.wikipedia.org/wiki/Roger_Penrose and anesthesiologist. https en.wikipedia.org/wiki/anesthesiologist Stuart Hameroff. https en.wikipedia.org/wiki/Stuart_Hameroff. The hypothesis combines approaches from molecular biology. https en.wikipedia.org/wiki/molecular_biology, neuroscience. https en.wikipedia.org/wiki/neuroscience, pharmacology. https en.wikipedia.org/wiki/pharmacology, philosophy. https en.wikipedia.org/wiki/philosophy, quantum information theory. https en.wikipedia.org/wiki/quantum_information_theory and quantum gravity. https en.wikipedia.org/wiki/quantum_gravity \2 https en.wikipedia.org/wiki/orchestrated_objective_reduction #site_note-h and PVS Reimers 2014-2 \3 https en.wikipedia.org/wiki/orchestrated_objective_reduction #site_note-Penrose 2014-3. In short, the theory is that consciousness is a result of quantum processes that are muted by the anesthesia. Multiple drugs are given in surgery. Ones that stop your memory, like propofol, great for you. Ones that paralyze you, great for the surgeons. Opioids to partially numb your body. Nerve blockers to fully numb certain areas. I once had my broken wrist reduced in emergency. They gave me fentanyl for pain and calming and propofol to stop me making memories and make me sleepy. I woke up mid-procedure. It hurt. I remember grimacing and moaning in pain. They gave me more propofol and then I woke up again after they finished. One thing I learned when MJ died. Anesthesia also doesn't replace sleep. Despite MJ being put to sleep every night with propofol, he was still experiencing severe physical symptoms of sleep deprivation in the days and weeks leading to his death. Experts say that even absent the overdose, he still would have likely died shortly thereafter because the propofol blocked out critical REM sleep. It would be like eating some sort of cellulose pellets instead of dinner, he said. Your stomach would be full, and you would not be hungry. But it would be 0 calories and not fulfill any of your nutrition needs. https www.cnn.com/2013/06/21/showbiz/jackson-death-trial/index.html. When you have surgery, the doctor gives you a special kind of sleepy medicine. This medicine makes you go into a deep sleep, so you don't feel anything, not even pain. It's like turning off a light switch in your brain that helps you feel things. While you're asleep, the doctors can fix what they need to, and you won't feel a thing. When they're all done, they help you wake up, and you'll feel better soon. To follow up on this question, why do I still have a good sense that time has passed when becoming conscious again? For me, once I'm knocked out, nothing happens and then I wake up sat up in a chair. In a very surface level of perception, it only seems like a few seconds have passed. But consciously and intuitively I still feel like it was hours that I was out. Is it instinct? Or because of my prior knowledge that I would be out for hours? Or because of my internal clock? It's always weird to me. I'm an anesthetist, and you do still feel pain while under general anesthesia. It just makes it so you are not consciously aware of it. This is often done through the use of volatile gases such as sevoflurane. We routinely give other medications such as fentanyl to blunt the unconscious response to painful stimuli, aka surgery. Sleep is active. The brain is taking a little vacation. General anesthesia is a near-death experience. For enthusiastic learners of business management, finance, and accounting, delve into key topics such as FP&A, budgeting, business planning, financial modeling, and financial statement analysis. Elevate your skills and knowledge with expert guidance through comprehensive courses designed to make complex concepts simple and actionable. Explore our latest course offerings here. Course link. Don't miss out. Subscribe to our YouTube channel for more valuable insights, tips, and tutorials. Watch now. LMS for course. https://class+app.com/w/ibs-zelixker/courses/534384. Subscribe to the channel. https://youtube.be/ivfpslick. C equals R88 ISNN0N3R7_NR2. For enthusiastic learners of business management, finance, and accounting, delve into key topics such as FP&A, budgeting, business planning, financial modeling, and financial statement analysis. Elevate your skills and knowledge with expert guidance through comprehensive courses designed to make complex concepts simple and actionable. Explore our latest course offerings here. Course link https class+app.com/w/ibs-zelixker/courses/534384. Don't miss out. Subscribe to our YouTube channel for more valuable insights, tips, and tutorials. Watch now. https youtube.be/ivfpslick. C equals R88 ISNN0N3R7_NR2. There's a great episode of Radiolab about this. http://www.wnycstudios.org/story/anesthesia/. I have chronic sinusitis and can have terrible headaches. Sobriety when I'm waking in the morning. I'm aware for some amount of time. Maybe less than 30 seconds. When I have no pain. Then as I become more aware, the pain moves in and stays. What's going on? My theory is you are fully aware and feeling during surgery, but the anesthesia paralyzes you then. Makes you not remember anything. For what it's worth, even under general anesthesia pain still hurts . The difference is that you are not aware of it. Instead, your body reacts to the pain as it normally would without conscious perception. I may have you completely anesthetized and you're comfortable. But once the surgeon starts cutting, if you don't have any painkillers on board, your heart rate will jump. Your blood pressure will go up. Your breathing rate changes and other physiological changes occur because they are built in to you. They do not need conscious perception. This is one of the main reasons that a standard 2-pump total intravenous anesthesia setup includes propofol, the hypnotic that puts you to sleep, and remifentanil, the opioid painkiller, because the remifentanil, along with other effects, acts as a very strong painkiller, so your body's responses to pain are reduced even under anesthesia. I like that analogy. It makes sense. I didn't realize how out you were with general anesthesia until I read that they don't just have a machine to help you breathe, but they are also monitoring your BP, body temp, etc., and adjusting as needed as per your awesome analogy. The building is truly off, no security guy around to run some low-level things. As a lover of analogies, this comment is gold. If the body is an office building, then anesthesia is a fog so thick the guards can't see shit. They might be there. The power can be on to various degrees. Don't necessarily have to have a ventilator. Half the people can't get what their work done. But the humidity is so high there's fog inside and outside the building, and if anything bad happens, nobody knows about it because it's so dang foggy. Anesthesia's effects are so bizarre and fascinating. Interesting add-on, my sister is a surgical theater nurse, and one day I asked her, so what is the anesthesiologist doing during the surgeries that go on for like 10 hours? After a slight hesitation, her response was, well, they're supposed to keep monitoring everything. But a lot of the time they just come and go from the room. Great explanation. Follow-up question. And maybe it's a Hollywood thing. But in the movies, when someone is unconscious and falls in the water, they make it seem like the person is unconsciously holding their breath. Is this true? If not, the person would breathe in water. In an unconscious state, is the body going to cause the reaction of attempting to cough up the water without the person regaining consciousness? This is the perfect explain like I'm 5 response. That's beautifully worded, thanks a lot. This is a great analogy. Why is lidocaine used during surgery when a patient is under general? If we can't feel the pain, what's the point? Curious how you would explain this to me. Well said, hands clapping. Why do some people report dreaming while under general anesthesia? I personally have. We hope. The nightmare alternative is that it just paralyzes you and screws with your short-term memory so you don't remember the excruciating, terrifying experience afterwards. Read Penrose Hameroff for an interesting theory. The pain thing is terrifying. I'm very grateful that we don't experience hurtfulness while we're anesthetized. Imagine being fully aware of the needles and tubes in your skin, slicing you open and draining you, organs and tissue pulled and stretched, and you're completely helpless to do anything about it. You have no mouth and you must scream. Thank God our bodies can be put out of commission. Also, the border between sleeping and waking is fuzzy. If I remember correctly, most people wake up a few times per night and fall back asleep. How awake they are is debatable, as they have no memory of it after the fact unless they saw, heard or felt something that prompted them to wake up even more. This is terrifying. There's a really good Radiolab episode that talks about this. https://radiolab.org/podcast/black-box. That's a lie and a half. I need you to explain everything in this world. Loudly crying folded hands. This is so easy to understand. I am mind blown. As a redhead, I had always heard that for some reason anesthesia was more difficult on redheads. Then I had all 4 of my wisdom extracted under general anesthesia. I woke up halfway through and tried to talk to the surgeon. He looked shocked and said, "Hey buddy. How ya feeling?" Quote. Then I immediately went under again. I enjoyed that explanation, thank you. Is this why passing out drunk doesn't make you feel rested at all? That was a great ELI 5. When I was a kid, under the age of 9 in the 80s, I had teeth removed on 2 or 3 occasions in the dentist chair by the dentist, and no anesthesiologist just gassed me up and got in with it. I think an element of luck might have played a part in keeping me safe. The office building analogy is great, especially since there's increasing evidence that sleep is when the metaphorical janitorial crews move in to perform maintenance and cleaning, greater than including pain. Anyone who has gotten leg cramps can attest that we absolutely can feel pain while asleep. It's also why it terrifies me the fuck out. Well, that's terrifying. I've heard many reports from people who say they've regained awareness during surgery, but still couldn't feel anything. So I feel like there has to be more to it than that. This is a great explanation. I'm now far more uncomfortable with anesthesia. Thank you. This is a great explanation, and also explains why your anesthesiologist makes a whole pile of money. I love your analogy. It really hits home after having kids. The security guards go on high alert. Things that never would have disturbed you before wake you up easily. And I imagine it will take a few years for the alarms to turn off and things to go back to normal. Quality explanation. That, or there's an unconscious version of me that got utterly tortured, and when I woke up I forgot about it, wondering why I had to scroll down so far to see a reply from an actual anesthetist, anesthesiologist. Anesthesiologist here too. I confirm all of the above. Greater than now when someone is under anesthesia. A big part of this chain of physiological process actually still takes place. The pain receptor still works. It still sends signal, and it still arrives in the brain. In fact, we do see it in the form of increased heart rate and blood pressure, etc. Even while you're awake? I had a surgery months ago. It was my first time. And I requested for my anesthesiologist that I wanted to stay awake because I'm curious what usually happens when a surgeon performs an operation. How many people will be there in the OR? How long does it usually take? Etc. I think the surgery only lasted for about 15 to 20 minutes. It was painless. Half of my body was numb down there. I wasn't nervous at all. My heart rate and blood pressure were fine or normal because I feel normal, except that I don't feel half of my body. Overall, it was a nice experience, since I think it's not all the time that a patient can witness their own surgery and hear their doctors talking or discussing things about your case when they're lying there unconsciously. The hell started when the anesthesia starts to wear off, and I cried, face holding back tears. When I got my wisdom teeth out earlier this year, the anesthetist also included an antibiotic and Voltaren in the cocktail. Is an antibiotic an anti-inflammatory part of the standard mix, or only used for specific types of surgery? I've had a couple EGDs this year and they give me propofol. Always blows my mind how fast that works. Hey, I think I feel okay. I'm now in recovery. If you don't me asking, if we understand the mechanisms of pain, and if we are able to temporarily disable it via anesthesia, why are we still so far away from being able to completely eliminate pain for suffering patients? What I mean is, even today there are millions of patients who are suffering from extraordinary pain nearly constantly. And from what I understand, the best we can do is give them painkillers which only offer very slight relief. What would it take for medical science to reach a point where we could simply turn off pain completely, such as that achieved during anesthesia? To add to the feeling pain part, the pain receptors and what follows afterwards don't just trigger a conscious response. You'll notice your heart rate increase, sweating, etc. when you hurt yourself. This and other things still happen during anesthesia, which is why we use strong painkillers, various opioids, to keep the body shielded from that stress response. It changes the way your immune system reacts. It stops your bowels from moving. It stresses your heart, etc. We still have more to learn about how all these things interact and how we can motivate the body's response to surgery to decrease complications like infection, wounds not healing correctly, or how we can possibly even trigger certain systems to react in a favorable way. Fascinating. How do you know the dosage is working as it should? Is it really possible someone can be sedated and feel pain in the normal sense while under and it not be noticed by you or the surgeons? Do patients have any memory of the surgical treatment afterwards? Is memory loss a risk? Do you guys follow the same anesthetic procedures for organ donation? I've heard both that you do, and you don't. Confusingly, both said they were doctors. Propofol is amazing. Its ability to turn off the lights is fascinating. I do have a question. If you don't mind, does propofol actually depress overall brain activity? I would think so via its effects on GABA. But NMDA antagonists like ketamine can induce anesthesia while increasing brain activity in regions that are typically inhibited. Furthermore, are patients on propofol truly lacking any conscious experience? Or is it possible it's like being blackout drunk? I think there's an experience to being blackout drunk, but you fail to encode it. Great explanation. Thank you. I recently had an elbow surgery and they gave a local nerve numbness for my arm at my collarbone region. Is this something special or is it quite common? And this method just prohibited the nerves more to send pain signals? Yeah, the stress of the pain and anxiety from a surgery would probably be enough to kill a lot of people. Anesthesiologists walk the fine line of making sure you don't experience any of that while also not putting you so far under that you don't wake up afterwards. And there's a lot of variables to account for. Some people just respond less strongly to most anesthetics and require doses that might kill the average person. Don't want them waking up during heart surgery. A friend who is an anesthesiologist put it in a similar way. I'm a pilot trying to keep a plane in the air and my co-pilot is doing everything in their power to crash it. The tacit blaming of anesthesiology for bad outcomes, which is woven into this, is also a tradition going back as long as anesthesiologists have been in the operating theater. My dad is a retired anesthesiologist and his joke was that putting you to sleep was cheap. It's the waking you back up that's expensive. True. So they're all screaming and no one's listening. That's terrible. Nope. Doctor here. They give you something for the pain, like fentanyl, etc. You're not just asleep, you also are getting incredibly good pain relief. Nerves during surgery really say, I have no pain reception and I must scream, huh? The movie https www.imdb.com/title/tt0211933/awake tells a story about some people still feeling everything. Almost like temporarily disconnecting the CPU from the motherboard, or rather blocking the circuits leading to it, but only for the awareness and consciousness pathways. The lower tier pathways still function. Thanks. You say, are you involved in surgery somehow? Just curious. Thanks for responding. What I understand about it, you also get something that prevent you from making memories. So even if you feel pain you won't remember because memories aren't made. Local can also last for some time. So typically the surgeon will infuse the surgical site with local as they are closing the body up. This is also to hopefully mitigate post-op pain. Though, I would much rather have anesthesia give people blocks instead. We don't inject directly into nerves, that would damage them. We inject around the nerve itself. Usually USUING ultrasound to guide us. Or a nerve stimulator to show us when we're close to the nerve. Or in field blocks we put lots of local anesthetic to flood the area where nerves run. Same for me with my Achilles surgery. What did you have done? There is a whole nother rabbit hole over on the other side of how does anesthesia work? And that is, wait, how the fuck does consciousness work? Quote, apparently some students at Wellesley think their recent work is relevant. https www.wellesley-teams-new/research-unlocks-important-clues-about-th. Nature of consciousness. To both. Sounds like OR as thesis being tested via anesthesiology. But what do I know? I'm just a dog. That last bit is wild, too. I've had 2 surgeries and they both felt like time travel. So it's possible that people feel everything and just don't remember? Yikes. So a version of me somewhat experiences it, but the now me just doesn't remember? That is terrifying. OMG. That is wild. Which is interesting, since the brain isn't shut off enough that it can't keep you alive. There's an element of truth there. Some medications used during a case have amnestic properties. The components of the anesthetic state are amnesia, analgesia, pain control, immobility, muscle relaxation, and unconsciousness, sleep. Although not actually sleeping, as we do every night, I have had this dark thought this many times in the OR. There are some fascinating studies being done now using EEG and some imaging modalities under anesthesia looking at what the hell is actually going on in the brain during anesthesia that reassure me this is not likely. Still a scary thought. So, I actually don't respond well to local anesthesia. I had a cyst removal where he kept adding numbing meds. But I could still feel. We eventually got a place that wasn't awful, but still stung a bit. But the surgeries I've had under general are like a chunk of time is erased from your brain. I can remember the anesthesiologist saying, "This will help you relax," and my next memory is, "Hey, you're awake. It's all done." It's kinda bizarre. I think you missed the explain like I'm 5 part and went to defend your doctoral thesis tears of joy. We debunked that theory decades ago. For some surgeries we do EEG that shows no changes in brain patterns, so you're definitely not aware. Plus, around half of surgeries don't use paralytics. So if you're awake and alert feeling pain and there's nothing preventing you from moving, then you'd move. But it was definitely an interesting theory. Greater than your heart rate will jump. Your blood pressure will go up. Your breathing rate changes and other physiological changes occur because they are built in. Wow, that's fascinating. I had no idea anesthesiologists had so much on their plate. I had a local to drain a sebaceous cyst, and thought nothing of it, until as the doctor cut the skin and began emptying the cyst. I started sweating. My heart started racing. And I got woozy. It didn't hurt, but my body knew what was going on. Greater than propofol. Shit is amazing. I underwent a small surgery one time and when the anesthesiologist came in with it, I kinda smiled because, what? That small injection is going to put a big guy like me to sleep? Please. After she was done with the injection, the surgeon asked me, unrelated, where I hurt me knee, and before I could finish off, I heard it playing football. I was completely out and woke up a couple of hours later in the hallway. 10 out of 10 would recommend. I think the most mind-feeing for me was doing an organ harvest on a brain-dead patient. You still have the spinal reflex. But hey, let's give paralyzing agents and the sympathetic response disappears. Is this what killed Michael Jackson? Was the propofol preventing automatic body functions like breathing and heartbeat? What about when I woke up in the middle of getting my wisdom teeth removed and the fact I didn't feel pain when it was happening, only pressure? 'Cause I remember the sensation from when I woke up while my wisdom teeth were being pulled. At least the last 1 or 2, not the first 2. Wait, so every surgery I've had when put under I was exposed to opioids? So is being under anesthesia like forced really good sleep? Like if I were to naturally sleep for 8 hours, would I feel even more rested if I was under general anesthesia? If no surgery was involved. As a ginger, thank you for that little extra to put me under. The curse of the soulless ginger is real, and an extra pain in the ass for anesthesiologist or a fun challenge depending on viewpoint. Standard Remy? You must be rich. Winking face. Fun fact. Michael Jackson towards the end of his life was taking propofol to go to sleep at night. Wow. Well, now I know why you guys get so well paid. At least in the US. Is there ever body movement, like flinching? So how does this work for things like spinal blocks for a C-section? I had one, but don't think my body had a pain response? Or is that kind of thing just totally different from what's happening under general? Isn't it true that you might feel the pain but not remember it? Because the memory is a higher level brain function? Whoa! Would the body's reaction be same with localized anesthesia, or does that work differently? I never knew this. Really interesting, thanks.